we look back at our country's history of last 70 years, India has achieved several milestones. Many of the scourges of humankind have been eradicated. By 1977, smallpox was eradicated from our country. In 2014, India became polio-free. And in 2015, we achieved defeat of eliminating newborn and maternal tetanus.
Last 65 or 70 years, major milestones have been achieved. Nobody in the world believed that India would be able to interrupt polio virus in India and we will be polio free. This was all possible because Indian scientists did outstanding research. India's polio eradication program undertook almost 35 to 40 research and innovations. As a result, today this program is considered the best in the world. Same is the story with a lot of clinical disorders. The biomedical scientists in this country decided, took up the challenge, and all these achievements could have been possible without adequate and relevant research in the area.
At present, low credibility of our public health system with the community is a cause of worry. People often complain about quality of care provided in the public system. If we have to improve our health system, research has to be integrated at the heart of healthcare.
If we have to move forward and come up with some of those cutting-edge advances in health, our biomedical scientists within this country and institutions located here have to find answers to some of those issues. We can find solutions to our own problem as well as we can help the other developing countries. And this clearly requires two major changes. One is create a cadre of highly dynamic and productive researchers in different parts of the country. Equally important is to create an environment of research in our institutions. It is not an easy task. While money is important, but an ecosystem which is friendly for the research is also important. If we have a cadre of committed research leaders in this country, they will also catalyze creating an environment which facilitates research, which supports research.
There is research going on in various academic institutions, but either this research is not targeting the problem. If it is targeting the problem, it is not taken to change the policy level. International Clinical Epidemiology Network, INCLEN, is committed to doing research to change the policy at the highest level.
INCLEN is a unique global network of academic institutions in 34 countries. We conduct collaborative researches in high-priority health issues and train future leaders in public health. Clinical epidemiology units and clinical epidemiology research training centers are core functional units of INCLEN in India. We work with more than 200 institutions, including medical schools, universities, research centers and policy bodies. We have been recognized as a research institute by Department of Science and Technology. We maintain strong and strategic relations with various government agencies and professional associations. Our members are part of several technical and policy committees at national and global level. With view of creating future leaders in research in India, INCLEN has started this unique training program on leadership and management. This 2-week residential program primarily focuses on biomedical scientists to enhance their program management skills. This includes elements like developing research proposals, seeking funds, grant management, human resource management, analysis and report writing, and finally, negotiation with policymakers for research translations.
The INCLEN Research, Leadership and Management Program is pretty unique. We do not teach research methods. The program is focused on bringing out the leader and the leadership in our future research leaders.
When I was in UNICEF, I realized that I have not been formally trained in strategic management and leadership. To cover this weakness, I joined MBA course in strategic management, and having completed that course, I realized that we in medical field, both in our MBBS and MD, are not taught the essential skills of leadership and strategic management. We thought of starting leadership program to train at least 100 leaders in health research in India. We looked around at various leadership courses available in India and abroad, and we found that most of these courses were very academic. Fortunately, we found an approach in UK being used in NHS, which was looking more at acquiring practical skills, and they used an approach which can be called fact, reflect and act. Under fact, the participant learn some of the aspects of leadership. They reflect on those aspects of leadership, identify their own strengths and weaknesses, and under act they develop a plan to sharpen their leadership skills, which we follow up after the training course.
LAMP course starts with giving participants exercises for identifying priority areas. Participants become eligible for face-to-face training after successful completion of these exercises. The approach begins with exploring essentials of leadership skills. Then, participants reflect on their skills. Following this, they prepare action plans to develop their leadership skills. An important feature of LAMP course is Meet the Leader sessions. Selected leaders in the field are invited to meet the participants, to share their experiences and guide them on developing leadership skills.
We talk about how to work in difficult circumstances, able to implement research projects when the resources are scarce. What are those elements which help us to balance between our teaching assignments, service assignments, undertaking research within those constraints, and not forgetting our families and our personal lives. So the LAMP program is primarily teaching our participants that within all the constraints we face, an environment which may not be very friendly, even in those we are able to identify the most relevant research questions, elements of simple hiring people, negotiating with our administration, translating the research into policies and programs, working with program managers, working with decision makers. These are all skills which required a very systematic approach.
The training came to me at a very right time in my life when I was preparing to take charge of the department. So it reinforced some things which I knew. It gave lots of tips on how a leader should be, what are the qualities and how to exercise them, how to put them in action, how to make them effective.
This is the best part of this course, that it is teaching you real life skills, how to address a problem. So the whole course is focused on learning many other real life skills other than your professional skills.
Team of 15 people, researchers, medical professionals from diverse backgrounds, staying together and sharing views, listening to leaders in the field. And it has been a wonderful experience. Most of the things that we have talked about or discussed, they are what we usually know, and at mid-level of career we already practice some of them. But this workshop helps us concretize them, makes us formulate a plan, and also gives us an opportunity to share with other professionals who are at the similar level in their profession.
When I came to know about this leadership and management programs, two things came in my mind. First thing, that is a unique program. I never heard such a program in India in the past. And second, as the title of the program is about leadership and management, so it appears to be very relevant to our job.
My idea was to get the experience or the knowledge how to approach the funding agency, then how to initiate research which is relevant to the public health area.
Our dream is that we should have at least 100 to 150 very vibrant young biomedical researchers in this country over next 5 years, so that they become agents of change. They are able to undertake relevant research wherever they are positioned. Many of us think that research can be done only in national institutions like All India Institute of Medical Science or PGI Chandigarh or CMC Vellore. But fact of the matter is that this country is full of very bright young professionals, and they just need showing some path, they need some mentoring. The whole purpose is that if we are able to enthuse these young minds, and they should go back within the context of all the difficulties they face in their environment, they should take up relevant research questions.
We request young faculty members in academic institutions to visit our website and look for next course announcements.